So your physician has just recommended to you Stivarga regorafenib for the treatment of metastatic colon cancer. And I want to just share with you how we handle that here at Georgetown's Lombardi Comprehensive Cancer Center. So Dr. Salem, when you make this recommendation, what do you tell a patient when they're just setting out on this treatment?
Sure. So the first thing we tell them, okay, how many pills you should take. It depends on the dose. We decided on 2 or 3 pills, or even 4 if that was the decision. We tell them take it after food. But I go over the side effect a little bit in details to warn them or inform them, like hypertension, hand-foot syndrome, diarrhea, fatigue.
So what's hand-foot syndrome?
So it's more like soreness. We describe more soreness of the hand and foot, and sometimes it's like calluses, if you will.
Yeah, they get tender. They have trouble opening bottles, things like that. Yeah.
I hope you don't get to that
Yes.
point. But really, what I tell patient is your job not to figure out what's going on or what causing it. Your job to report to me and my team that how do you feel, and we'll take it from there and hopefully find out the reason and solution. And I always encourage them to call us anytime and any moment they feel anything wrong with them.
Okay, so be very clear. The standard dose is 4 pills, but a day, every day. But the doctor might recommend 3, might even recommend 2 pills every day. And then you're going to see that patient back in 1 week, and some blood tests will be drawn, and the doc will want to look at your hands and ask you how you're doing. Keep a journal, keep track of how you're feeling.
I think that's a good idea, because sometimes also patient forget, and doctor also can sometimes need to see this information to make an adjustment.
Yeah, Monica, key things that a brand new patient needs to know when they're starting out on Stivarga.
Sure. So I usually go over a couple things. Number one, I like it a lot when there's a family member or a friend in the room, because this is going to be somebody that helps keep you on track. It's a lot of information to remember at once. This can kind of be like your go-to person. So we're going to go over side effects. I go over, more in depth, things to look for. If you're having nausea, if your hands begin to be red, dry, cracked, anything like that, then they need to absolutely let me know as soon as that happens so we can stop it before it gets worse.
So don't wait for that week appointment. Call you, email you.
Day of.
Day of.
Yep.
Okay. Because we might hold the drug on that
Right.
day. Okay.
Right. And then another thing that I, talk to them about is pharmacy. A lot of times these types of medications are going to come through a specialty pharmacy, so that's going to be different. You're not going to go across the street and pick it up. It's going to come in the mail. And then another thing is just maybe they've not been on these oral therapies before. Maybe they're used to IV drugs. So, this is going to be kind of up to them to remember to take their medicine. There's not going to be a infusion nurse there.
Yeah, so that's a really important point about the drugs may not come. So we're used to writing a prescription, going to get it that night. Unlikely, right? It's going to be a few days. Right. And so we as healthcare providers need to keep track of that as well. So any other key issues you want to add?
Yeah, one of the things, sometimes, especially if you take a lot of medication, you forget if you did or did not take the medicine. And I always warn my patient, if you have that doubt, don't take it, because you might double up on the dose. Or if you vomited or something, you don't also take it again.
Take it again. And this drug is very sensitive to light, so it comes in a special bottle, and you only get, 1 month's supply at a time. 1 week's is in each bottle, I think, is the way it's provided. So check the dose, make sure you're clear with your doc, check the schedule. You should have an appointment about 1 week after starting. It may take a little while for the drug to come. Watch that first week around your hands, nausea, diarrhea, rash, I guess, is on the list too. Report right away if something's going. Don't wait till that next visit. Good secret, good plan to make sure that Stivarga regorafenib has the best chance of working for you.